This is an in-depth look at spina bifida. In the Latin term, spina bifida means spina equals spine, and bifida is cleft. In other words, meaning split spine. The reason for the spina bifida to be created is called a neural tube defect. The neural tube is what creates the brain and spine at the very beginning of creation. And what happens is that when the neural tube is created, it is created in a open position and usually is closed by the first month of life. Spina bifida happens when the neural tube does not close fully, and it allows the spinal cord and surrounding areas to become exposed and move out of the vertebrae. Spina bifida affects about 2,000 of every 4 million births. Spina bifida is put into 4 different categories depending on their severity or development. And excuse my pronunciation of these 4 categories, but the first one is oculata, and this is the very simplest form of spina bifida, and sometimes goes unnoticed because it is such a mild form. It sometimes even the person that has it does not notice it until it is discovered. And there are very little side effects. There are no physical form side effects or mental issues. The second form is called closed neural tube defect, and is much like the first form, but there are malformations along the spinal cord, such as little bone fragments or other growths that can cause problems. It can lead to some levels of paralysis and bowel and bladder control issues. The third topic, or the third category, is meningocele, and this is the rarest form, and this is where the membrane presses out through the normal formed vertebrae. So you have the normal vertebrae, and somehow the membranes around the spinal cord get pushed out through that bone area. And this is easily fixed, and usually there is no nerve tissue in that membrane, so it is surgically fixed, and there are no or little side effects after the surgery. The fourth form, which is usually the stereotypical form of spina bifida, is myelomeningocele. And this is when the spinal cord and its surrounding areas protrude out through the vertebrae because of the opening and out of the back, and usually a sac. Sometimes there's not a sac, but usually a sac encloses that part of the spinal cord. And there are lots of physical defects and sometimes learning disabilities. The physical defects, such as paralysis and bladder and bowel control, is determined by how high up on the spine that the protrusion has occurred. Theories behind spina bifida, besides the general genetics and environmental effects, there has been a link to folic acid during pregnancy. Folic acid is basically a vitamin D, and you can get plenty of it if you have prenatal vitamins. The problem with spina bifida is that this occurs so early in the pregnancy that a a lot of people don't know that they're pregnant and aren't taking the vitamin B or prenatal vitamins that are necessary to help prevent spina bifida, and therefore it's very hard to prevent or to recognize that there's going to be spina bifida in the very beginning. What they do know is that taking vitamin B or prenatal vitamins can reduce the risk of spina bifida up to 70%. But it's important to uh, be on that vitamin. Definitely be on vitamins or prenatal vitamins during the early stages of pregnancy. It was actually in the research that I did, was suggested that if you are attempting to get pregnant is to already be on the prenatal vitamins can help with this issue. Treatments, it depends on the severity. Like I said, the first category, there's very little defects or problems, and therefore sometimes doesn't even need any kind of surgery or physical therapy. And as it gets worse, or as the spina bifida stages are more pronounced, there may be need for more surgeries. There are two types of surgeries that they can do, and the first one is the fetal surgery, where they do the surgery while the baby is still in the womb. There are two sides to that. One is that it can eliminate a lot of the damages created from labor because it's already fixed. And also, if it's already fixed, there is less likelihood that there's going to be more damage done while the baby is developing. The drawback of that is that the chances of premature labor and infection are higher if you have a fetal surgery. The other type of surgery is after the baby is born. Within a few days, they take the spinal cord and put it back into the back of the child and close it up. And unfortunately, the damage has already been created and there is no repairing that damage. So what has been done has been done, as far as paralysis goes. So the most important thing is to close it up so that there's no chance of infection. Other types of surgeries that can help with spina bifida is a C-section, because of a baby going through the normal labor will have a lot of pressure put on its back and could cause more damage done that way. So a planned C-section can avoid a lot of that pressure put on the back of the baby, and hopefully not allow any more damage to be done. And it's very important for children with spina bifida to have physical therapy to help develop what is not damaged and develop that so that they can live a productive life. There are a few learning disabilities linked to spina bifida: motor skills, hyperactivity, problem solving, decision making. Although these are some things listed, there are plenty of children with spina bifida that do not have learning disabilities, and they are fully functioning other than having the paralysis and other limitations physically. And of course, with they have individual rights to make sure that they are having an equal opportunity in the classroom with individuals with disability acts, Education Act, and Section 504. And that ends my presentation. Thank you.